the opposite of addiction is connection. So when we're reaching out to individuals and we're saying, we understand where you are and we appreciate you and we want you to be safe and here's some Narcan and we'll be back tomorrow. Please let us know if we can get you anything. That's going to be more receptive to people to want to come to us, to recover and move forward from whatever situation they're in, rather than just abandon them in some homeless camp or something.
All right. Welcome back, everybody, to another edition of Finding New Waters. Sitting here with our CEO, Justin McClendon. My name is B. Reeves. I'm the Director of Business Development at New Waters. And our special guest today is Lindsey Humphreys with Illuminate North Carolina. I don't want to try to talk for her, but I'll just say that I've known Lindsey now for coming up like 6-7 years, something like that. We both got sober around the same time and watched her grow in the field, and she's got a lot going. So tell us what you do.
Well, I am the director of Illuminate North Carolina. So we have 3 separate programs where we're working on reaching individuals on different modalities of recovery, depending on where they're at. So the first is a harm reduction program, which is no barrier naloxone distribution in Wake County. The second is sober companions, one-on-one client live-in care throughout the country for individuals, executives or high functioning who need the additional accountability and support while they transition out of intensive rehabilitation. And the third is Bob's Way, which is a recovery center that's peer run and focuses on a variety of different recovery modalities and has free recovery resources for a rural underserved community in Vance County.
Cool.
Very cool.
And Bob's Way is the namesake of your grandfather, Bob Goodell. And I was going to say, we've had one mother-son, not on the same time. We've had one mother and her son. We're on here individually. You'll be the first grandfather. And I wanted to say too, when I met Lindsey, like I said, we got sober around the same time, and she would always talk about her grandpa and never said who he was, but would talk about how her grandpa had been sober a long time. And then, I'd been sober for a few years, started working in the field. And then it was only until right around the time that he, died at the age of 90,
Mm-hmm.
Lived probably the fullest life of any human being I've ever met in my life. Amazing person, pillar in the recovery community that I put together. That was her grandpa that she was talking about. And so she does have some humility. I can attest to that.
Yeah, he was an extraordinary person. And it was funny working in the recovery field around him because I'll share a story. I was at the RAI convention a few years ago with him, and we were sitting at the same table together, and he was on his phone, not paying attention. So I shouted across the table to get his attention, "Grandpa, Grandpa." And a lady next to me said, is that polite to be calling him that? And I said, well, that's his name. And she was like, well, just because he's old. And I was like, oh, no, honey, that's my actual grandpa. And so they had a presentation where they stood up and they said, this is Bob Goodell and his granddaughter, Lindsey. And I realized how many times in my life there must have been me, shouting, Grandpa, Grandpa, in a public setting or a professional setting, and people didn't know he was my actual grandpa. So
That's so funny. That is so funny.
What a perfect namesake. I mean, if I could capture anybody's spirit I've ever met in life, especially in recovery, it would be his, no question about it.
Yeah.
Mm-hmm.
I mean, when he was on here, he had just turned 90, I think.
Yeah, I think so, yeah.
And he had just also rappelled down the tallest building in Raleigh.
Yeah.
And had just flown like some kind of jet plane, like a fighter plane. I mean, something crazy.
I mean, he was extraordinary. When the day before he died, he had come back from hiking at Arches National Park, sleeping under the stars. He got up early that morning, went to the gym. He was going to be doing landscaping that day. And he had just gone to see the new Healing Transitions men's campus and building progress. And, he was living a great day that day.
Yeah.
Mm-hmm.
Yeah. What an extraordinary life.
Yeah.
Yeah.
Something to be admired and a legacy that I hope to live up to in some way.
Yeah. Absolutely.
So Bob's Way, tell us about that, first of all.
So I think the thing with his recovery was he was very passionate about unconditional love. He was very passionate about harm reduction, meeting people where they were. He often went into the camps here in Raleigh to go meet people and discuss with them. And he was just very welcoming to wherever people were and who they were. And he enjoyed getting to know people who came from different lifestyles or backgrounds than him. He believed in learning and seeking. And so I've tried to carry those ideas to Bob's Way, where we have different modalities, SMART recovery, 12-step, Dharma recovery, a variety of RAP programs, things like that, to reach people where they are in their recovery journey. And majority is no barrier. So there's free resources in the evening, every evening, and during the day is a insurance funded IOP.
Okay.
Mm-hmm.
And why Henderson?
Henderson is one of our most impoverished counties. It has one of the lowest employment rates, one of the highest incarceration rates. It used to be a furniture capital of the world, which no longer exists. And so much of the downtown is a shell of what it used to be. Mm-hmm. It reminds me a lot of a town that I grew up in, which was Scranton, Pennsylvania. Okay. Scranton, Pennsylvania used to be a very vibrant city. And after coal was no longer king, it died. And when I was sick and I was in Scranton, I wanted to help people, but I wasn't able to. And so when I came here to Raleigh and I eventually got well and I found Henderson, I felt that that would be a good place for me to start, someplace that reminded me of home.
Yeah, when I heard that you were doing it at Henderson, the first thing that stood out to me was that it was underserved and a proportionally much higher percentage of addicts. And mm-hmm. what I had heard was, and I think this is true, and tell me if I'm wrong, its location on 85 and 95 was a halfway point between Miami and New York, and it was just like basically like a transfer station for drugs coming up and down the eastern seaboard. Is that accurate?
That's what I've heard, yes, that it's some kind of transfer point, and so drugs really flourish there. Most of the time when I hear about Henderson or I tell people I'm going to be working out in Henderson, they have some kind of drug-related story to tell me that they used to go buy drugs there or they used to sell drugs there or something of that nature. So the drug trade is very intrinsically tied to that town.
Yeah, that's interesting.
And then the other piece, so the companion piece, mm-hmm. tell people about that, because not everybody, I didn't know what a sober companion was or a sober escort or mm-hmm. pretty much anything until I was all of a sudden, in treatment and then in recovery. So what do sober companions do?
Well, sober companions are 24-hour live-in accountability partners. Some places call it care partners, and I like that term as well because we walk through life with individuals early in recovery. Sometimes they're encountering very stressful situations or going back to family dynamics, a lot of times going to stressful jobs that they can't just completely quit their jobs and their lifestyle. So you have to go back to that reality. And so we're a bridge. We help transition them, help them get reacquainted with their community, especially the recovery community, get them tapped into meetings, help them find structured therapy if that's something they're going to pursue in their area, and really do on-the-ground management with them while working with them on what their recovery plan looks like.
Very good. And do you do much of that work here locally?
No. In the past, I've done it in LA and the Hamptons.
Very cool. Mm-hmm. That's awesome.
Yeah. Go ahead.
I was just going to say, I mean, it is definitely a needed resource for people. And I mean, we know very well, we do a lot of referring, obviously, from New Waters to longer term residential programs. And then that transition back to home a lot of times can be a very, very tricky situation. And we've seen a lot of times where having someone that provides that kind of service is very, very crucial for that mm-hmm. process to be, for that person to be successful in navigating those things, right?
Yeah, absolutely. It really helps with relapse prevention.
Mm-hmm. Yeah. Mm-hmm. Especially right when somebody gets home, just to mm-hmm. that extra little nudge. Because sometimes, I mean, myself included, just my brain worked a lot differently than it did before I got sober. And I I set a lot of reminders on my phone. Some of them I still use, some of them I did, but I mean, I had to really make an effort to make sure I did those things that were suggested of me every day. And, I probably could have handled a companion, could have helped, but I just, especially, and I wasn't coming back to a wife and kids. And, I was able to kind of have a small little life where I didn't have too much to manage, but we see it all the time where people have got, businesses and, a wife or an ex-wife, a wife and an ex-wife and kids and stepkids and all kinds of stuff to manage. And then they just need that guidance to make sure that they put their sobriety first. So all that other stuff can benefit as a result of that.
Absolutely. Yeah. And I mean, crisis also comes in all kinds of forms. So I had a period of time about a couple years ago, I maintained my sobriety, but I was very depressed. And I had a friend come live with me, and he was with me for about 7 months. And really, he was my sober companion. We would go to meetings together. He helped me with my accountability. He made sure that I was stabilized because I was still working and I was moving forward in my career. It's not like I could or I even would have qualified for a residential treatment program, but I wasn't fully capable of going through the day-to-day life by myself. I needed that partner.
Yeah.
That's really cool.
It makes sense. And I was just thinking as we were talking, sometimes it's these big things that people need help kind of navigating, but sometimes it's, maybe somebody, it's the first time they've gone to treatment and they're going to return home. And like, maybe they've done some meetings and, they went to some meetings while they were in treatment and they saw the doctor while they were in treatment and they saw their therapist, but now they're home and now they have to get to the meetings and they have to get themselves to the psychiatrist and they have to get themselves to the therapist. And I think having that additional support to just kind of give those nudges and make sure that person's kind of staying on task until they can get the traction and start to do it independently can be absolutely huge. Absolutely huge.
Yeah, absolutely. And I really tried to weave in those principles that my grandfather taught me about recovery, specifically around service. And so when I work with individuals, I try to get them active in service as well as active in meetings, active in their recovery and things like that. So always keeping his spirit in it.
I love that.
Yeah.
I love that.
Well, they say service keeps us sober for sure.
I found that to be true.
Yeah, me too. And I don't do enough of it. But just talking to newcomers, though, is service. And, the days that I talk to a bunch of newcomers are usually my best days. So there's definitely a correlation. Well, how did you, when I met you, you were getting a master's degree in what?
HR.
Okay.
So I have a master's degree in Indian history, but it's not too marketable. But I worked in HR for Health and Human Services, both for Wake County and for the Department of Health and Human Services for the state. And that's really where I've learned about different treatment modalities and the way treatment is provided and regulations and things like that. I've had really great mentors and teachers on the ground who've taught me things. And I was lucky when I first came into sobriety. I was working for a nonprofit for Easter seals. And I was all of a sudden surrounded by individuals who actually understood mental illness and they understood substance use. And even though I was very in the closet about my drinking, I remember a meeting where an individual assured all of us that we were okay, we were safe. And that was one of the reasons that I had the courage to go to my first meeting because I felt my work environment was supportive of me. So I'm also very passionate about recovery-friendly workplaces. But as I learned more about recovery and the value of peer involvement and lived experience in recovery, I transitioned from that line from HR to the actual administration of an organization myself.
That's amazing.
When you were getting your master's and, couple of years into sobriety, did you think you would be working in the field and this capacity as like a founder, owner, executive director?
No, I mean, I've always loved working in HR. I'm a recruiter by trade, and I've always found so much value in that. I think everybody has their own purpose in life as far as career to give back to the community. So for me, working in public service and recruiting and putting people into the right jobs, that was very meaningful for me. I think what just ended up happening was with all of the shifts in government and some uncertainty around funding and grants and things, and also the the death of my grandfather, I felt inspired that it was important for me to go be of direct service to individuals. So I've been working on getting my certified drug and alcohol counselor certificate. I've been doing the sober companions, and I've found a lot of value from that direct work.
That's amazing.
Yeah, that's really cool. And so will you be a therapist at Bob's Way? Is that part of what your purview?
I think I might participate some in the IOP, but we have licensed clinical licensed clinical substance abuse counselors who actually primarily run the IOP.
Very cool.
And will you, so you mentioned harm reduction.
Mm-hmm.
We know what it is. Most people don't.
Mm-hmm.
Will you tell what is it?
Well, harm reduction is a way of meeting people where they are. Some people are not ready for full abstinence in recovery, or they're not moving towards full sobriety or abstinence, but they do need some tools to help them be safer. I think one of the ways to think about it is helping someone get to the next day. And we hope that one day, if it's in their path, that they will choose recovery and sobriety. Sometimes people don't. But we don't want them to overdose and die.
Absolutely.
Because then they get no more tomorrows. And so harm reduction, a lot of it has to do with Narcan distribution, education. Some of it has to do with safe syringe programs, although those are a lot more controversial, especially in rural North Carolina. They're a little bit harder to get funding for. But it could be things such as fertility care or, planning, women's planning, things like that as well.
And so the idea with harm reduction, you just said it, is just to give people a fighting chance, just keep them alive, and maybe they'll find recovery and abstinence, or maybe not. But the idea is for them to at least have that chance. Is that about right?
That's correct. Okay. In the old war on drugs idea of addiction was that we abandoned people when they were sick, and we, as a community or as a society, we wrote them off. But that obviously didn't work. And we know that the opposite of addiction is connection. So when we're reaching out to individuals and we're saying, we understand where you are and we appreciate you and we want you to be safe, and here's some Narcan and we'll be back tomorrow. Please let us know if we can get you anything. That's going to be more receptive to people to want to come to us, to recover and move forward from whatever situation they're in, rather than just abandon them in some homeless camp or something.
Yeah. You mentioned, if you want to talk about this at all, before we started, you were talking about the zero barrier kind of dispensing mechanisms that you have had the opportunity to kind of set up around town. Can you tell us a little bit about those?
Yeah. So part of the opioid settlements, which was the settlements with Walmart, CVS, Purdue Pharma, in regards to their purposefully getting Americans addicted to opioids, was a billions of dollars of settlements that were distributed to the states and to the individual counties. Each county in North Carolina was able to make its own plan of how they would like to use the funds. And here in Wake County, we have an amazing opioid settlement manager. Shout out to Alyssa Kitlis and Nicole Singletary for Wake County, who manage those programs. And one of the programs that I'm doing in conjunction with that settlement is to provide no barrier naloxone distribution throughout the county. So taking newspaper boxes and putting Narcan in them, which are actually not Narcan, sorry, that's the brand name, Naloxone. So this brand is called Revive, which is compassionately dosed, and allowing individuals to just take it as they need it or take it for others, have it in their cars. Naloxone is extremely shelf stable. So you can put it in high heat tolerance. So it can be in cold. You could leave it in your car all summer. It will work. And everybody, in my experience, should have it. We've had a lot of instances where in the news or anecdotally, we've met people who have encountered someone they didn't know on the street, and they were able to use the naloxone in their car to revive them.
What does compassionately dosed mean?
So the brand that we use, Revive, is manufactured by the only nonprofit pharmaceutical company in the country. And what they did was they met individuals and surveyed them on their experience in being brought back from an overdose with Narcan. And Narcan is 4 milligrams. So from what I understand, the experience is a very difficult withdrawal. It throws you into withdrawal immediately, and it's very disturbing on your body and mentally. This Revive is 3 milligrams, so it doesn't bring you back as violently, but is still as effective.
Okay, interesting. No, I'm glad you cleared that up. So basically, it works, but it doesn't. It's not overkill.
Exactly.
Okay.
And these have been kind of strategically placed. These dispensing cabinets have been kind of strategically placed around the county. Is that correct?
Yeah. So we've been working with stakeholders in the community, doing stakeholder mapping and trying to identify where they would be most useful.
Yeah.
We're starting with 10 this year, and hopefully we'll be expanding them more. But
That's great.
Yeah, very excited about it.
It is exciting because, I mean, as you said, that the work is so important, going into the camps and, going to people and like trying to connect with them and provide them resources and make sure they have access to these life-saving tools. But I love the idea that if someone didn't come to them, if they knew how to get to where it was, that's another really, really important thing that I think we just simply haven't had, at least not to my knowledge anyway.
I know NCHRC, they have a mobile delivery unit.
Okay.
But they're covering such a large population in such a large county. I mean, they do a fabulous job with what they do. But whatever we can do to create those access points in more public places, that's what we're also aiming to do.
Yeah.
Where are they generally located, the access points?
So there'll be one at the Recovery Community of North Carolina, which is co-located with Wake Monarch. There's one over in Coastal Horizons. I'm working on getting a location near Moore Square.
That's what I was thinking about.
Yeah. But there's also going to be the Peer Resource Network is starting a recovery cafe out there on Moore Square. So that's going to be a fabulous addition to our community.
Oh, cool. Very
cool. They should be opening that soon too. And I'm blanking at all the other places. People ask me this and I should have it written down. But,
fine.
Basically we worked with stakeholders to have them identify where they thought would be the best places. We didn't come from like a top-down approach where we looked at the situation and said, this is where we think it should be. We worked with the community to decide.
Yeah.
That's amazing.
I like that.
That's great. I'm just happy to hear that that's something that we have here in our neighborhoods. I mean, that's exciting.
Yes.
Yeah.
Yes.
So when you, how do you foresee, so you're going to have an IOP as part of Bob's Way. That'll be a nighttime IOP. Is that right?
Yeah. We'll do nighttime, daytime, and then also like primarily a weekend one.
Okay.
So
cool.
we really want to allow individuals who are, working and have different obligations to be able to come. One of the other components of Bob's Way is that we have an on-site drop-in childcare center.
Oh, wow.
So individuals can bring their children and we'll watch them while you're in treatment.
That's really
amazing.
Cool. I mean, you're just eliminating the barriers.
Gosh, I love
That's the idea.
Yeah.
I mean, we look at all those social determinants of health. What is keeping people sick?
Yeah.
And allowing them to get so sick in the first place. And what can we do to address those?
Yeah.
That's great. That is absolutely fantastic. I mean, I'm thinking of exactly that. Like when we're talking to clients and we're trying to talk them into doing, whatever level of care. I mean, like those are the exact types of things that they bring up is, access to, or I have kids or like all those things or jobs. And I think that's another thing you run into with other, outpatient services or IOPs in the area. Not all are created equal, but if someone only offers, let's say like a daytime IOP track, well, what about the individuals that like work during the day and really need like an evening track? So I think it's great to just offer that flexibility and be able to, meet those people where they are.
Yeah. And a lot of those ideas came from my own experience or my friend's experience. So when I was getting sober, I was interested in attending an IOP, but it was only during the day.
Yeah.
And I had a full-time HR job Monday through Friday. And I couldn't leave my career track at the time to go to IOP. I wasn't ready to, I guess. So, it was difficult for me to try to find an IOP. I actually didn't go to IOP because I couldn't find one that I felt met my needs.
Yeah.
Yeah.
Makes sense.
Yeah. It's a tough ask because when programs have the flexibility and when we're talking to a client and we can already have those barriers overcome in our back pocket, it makes it go so much smoother. But then sometimes you get in a situation where, yes, they have this job, the IOP meets at a certain time, but it's unrealistic that they're really going to be able to get there. And so maybe they kind of think they can or want to, but somewhere maybe no, they can't really make it. And then once they've signed up for that, then it's like, well, I couldn't get there by 5. There's traffic, and then a few days go by, and then next thing you know, that person's missed it altogether, and back at it.
And then I think number one, they don't have that support that they probably needed. And then the other piece is that sometimes we don't think about is like, there's also that feeling of like, self-disappointment. I didn't follow through. That's just another, tick on the list of things that I just didn't do that I was supposed to do. Right.
That's Absolutely. A great point. Because those things just build up and build up and build up. And the only way I knew my solution to all that was just a substance, and then finally, get sober, and we're trying to get some traction. And then this thing that was sort of out of our control, but it still has that same feeling of inadequacy and shame and all that can lead right back to relapse. Yeah,
absolutely.
That's what. Where do you see these people living? Are there sober livings in Henderson, or?
I know Oxford House is working on getting a sober living house up there, but it's not that I'm aware of any particular place. So eventually we'll probably expand to a sober living for women or a transitional house or something like that. But
is it just women? I didn't mean to interrupt you.
No.
Okay.
Okay. No, but as a woman, I have more affinity. And, when you look at men's houses versus women's houses, there's always more places for men to live than there are for women to live. Yeah.
I mean, I think in the recent past, I'm rewinding like maybe 6 or 7 years ago, just still trying to kind of get the lay of the land. So moved up here from Florida, not to make this conversation about me, but moved up here from Florida almost 8 years ago. And, coming from a place like South Florida, it was like treatment was everywhere, good sober livings everywhere. I mean, there was bad ones as well, but like there were plenty of like good options for treatment. And then we moved here, and I just remember the first conversation about like needing to find sober living for someone. First off, it basically almost didn't exist, but it only existed that I was able to find for men. I mean, like you couldn't find a sober living for a woman in this area unless it was an Oxford House, but like, a truly like managed sober living environment. Like it didn't exist. And it's still extremely,
I don't think there was anything until about 2 years ago. And that's pretty sparse.
Yeah.
And you look at situations like rural North Carolina, Vance County, which is 252 square miles, doesn't have one single AA meeting, much less women's sober houses.
Really?
They have 2 NA meetings, but we're going to be bringing the AA meeting, and we'll start that every week.
That's amazing.
But so the idea of having a women's sober house there's nowhere for you to go, So.
Wow.
You're changing the world. You are.
Well, we hope to create a community of practice and a community of recovery. In Wake County, we are so lucky to have as many meetings as we have, to have so many treatment centers and programs and people who are invested in the well-being of individuals with substance use disorder. And when we go right outside our front door, 30 minutes away up in Henderson, there's just nothing.
Yeah.
And that's a big part of why I moved to North Carolina, because my grandfather was, a member of the recovery community here. And I figured it might be a good place for me to get some recovery. And I ended up living with him and had a live-in, built-in family sober house, right? Because he was living there, and then my mother moved in, and she's going to be celebrating 46 years of sobriety next week.
That's amazing.
And then me. And so we had 3 generations living together, going to meetings. And I was so lucky to have that. That was the best time of my life.
That's amazing.
I hear you. Well, your grandfather was an amazing guy. You're definitely doing a great job living up to his legacy.
Thank you.
How do we find you? Can people find you to reach out for all the things you do?
Well, you can call Grandpa's phone, which is 919-522-5990.
Okay.
And that is the phone for Bob's Way. And then you can find us on illuminatenorthcarolina.org or bobsway.org.
Awesome.
Amazing.
Thank you so much. Well, congratulations on all you're doing.
Yes.
And thank you for being here today. And we're very lucky to have you in our community and in Vance County and Henderson.
Thank you. Thank you for having me.
You're
Thank
welcome.
you so much.
Awesome. If you liked what you heard today or just want to know more, give us a call on 919-670-8119 or visit us at newwatersrecovery.com. Thank you.